called mucormycosis or black fungi. Mucormycosis is a rare but an aggressive infection that complicates matters, especially in the middle of the ongoing COVID-19 pandemic. Experts say that it can maim patients who are recovering from COVID-19, as it happened in India earlier this year. Lekishon Laban gathered information about this fungal disease using local experts to help us understand its effects and possible cautions and treatments.
We should be always alert, not only seeing the COVID-19 positivity.
Mucormycosis, one has to surgically debride all the tissues which is affected. So that causes mutilating, it causes mutilation. If it has affected the eye, one has to remove the eye.
As the world continues to struggle with the ravages of the COVID-19 pandemic, a number of health and medical issues continues to emerge, even as scientists continue to find a permanent solution. Earlier this year, India witnessed the worst upsurge of COVID-19 infections, with a new variant of the disease posing a major threat to a country regarded as a pioneer in medical invention. Despite being a pioneer in COVID-19 vaccine production, India was overwhelmed. It was discovered that a fungal infection was becoming a nightmare in managing the pandemic among patients, especially those making a recovery. The fungal infection is now known to the medical experts. It is mucormycosis or black fungi, which was previously known as zygomycosis.
The cases of mucormycosis on the rise. Fortunately, in Kenya, we have not came across in any case till now. But in India, it wreaked havoc in the month of May, June, and July, and still there are few cases of recurrent mucormycosis also.
Willie Kemboy is a biomedical scientist and a microbiology lecturer at Baraton University.
When you hear of the term mycosis, it comes from the term mycology, which is the study of fungi, and the muco means the mucous lining that lines the respiratory system and some organs like kidney. So when you talk of mycosis, it means infection of the fungus, just as the name mycology means the study of fungi. So mucormycosis is the infection of the fungus in the mucous lining.
Doctors in India believed mucormycosis was being triggered by steroids, which are the life-saving treatment for critically ill COVID-19 patients. They explained that steroids help reduce inflammation for COVID-19 patients, but at the same time reducing immunity and pushing up blood sugar levels in both diabetic and non-diabetic COVID-19 patients, triggering mucormycosis.
The mucormycosis, the fungus, has high affinity for blood glucose. It also has high affinity for iron-containing tissues. So it is postulated because of COVID infection, the blood glucose in the body gets raised, and that can be a cause for the mucormycosis to invade the tissues and start spreading inside.
COVID-19 by itself as a virus may not actually cause a serious problem unless there is an underlying condition. So this is a scenario we can say it is comorbidity, where infection by the fungus facilitated by the virus now contributes to the loss of life among these patients.
According to the Nairobi's MP Shah Hospital mycology doctors, mucormycosis infection is more deadly in individuals with underlying conditions such as diabetes, those receiving steroids, renal transplant, immunosuppressive treatment for leukemia, or patients on chemotherapy and radiotherapy.
Along with that, if somebody has a diabetes, he has to monitor his blood sugar carefully. Oxygen saturation should be monitored. The patient should not use steroids, either himself or the physician should not use steroid before 10 days. If somebody wants to use, it should be used as much low dose as possible. If somebody has a breathlessness, he can use inhalation steroid instead of using a systemic steroids, that under medical supervision.
Remember that my cells and your cells and the fungal cells are almost the same. So as soon as you administer antifungal, you're also affecting our cells. So to some extent, yes, we can control, but it is a little bit challenging. It requires a longer time of treatment.
According to the United States Center for Disease Control, CDC, the symptoms of mucormycosis depends on where the fungi is growing. It includes rhinocerebral mucormycosis, which affects the brain with symptoms such as one-sided facial swelling, nasal and sinus congestion, black lesions and nasal bridge, and fever. There is a pulmonary or lung mucormycosis with fever, coughing, chest pain, and shortness of breath as symptoms. Another type includes skin mucormycosis with symptoms such as black blisters, infected areas turning black, pain, warmth, excessive redness, and swelling around the wound, among other symptoms.
Fungal infections are not common. But upon infection, I can tell you, Laban, for free that it is very stubborn to treat. The treatment that is administered to COVID-19 patients also, like prednisolone, influence the immune system. So there is a high chance that black fungi or mucormycosis will accompany COVID-19 immediately after recovery.
Now, in terms of our life, it can take one's life just in 3 to 5 days time if it is really virulent. So that is very expensive. Life, one cannot restore the life, first thing. Considering the cost of the surgery and the post-operative management and staying in the hospital and the medicine, the cost might be as high as up to 1.5 million for an average patient. So too expensive to treat, and along with a lot of disability, even when the patient survives.
In severe cases in India, doctors explained that they have had to surgically remove the affected parts like an eye to stop the fungi from reaching the brain. It hasn't much affected Kenya, but mucormycosis is deadly and costly, especially in the ongoing COVID-19 pandemic. An antifungal intravenous injection costing around Kenya shillings 1,800 a day and has to be administered up to 8 weeks is the only drug against mucormycosis. Lekishon Laban, TV 47, Nairobi.